Good evening, everybody. Thank you for joining our webinar tonight. I'm Cassie. I'm a communications specialist here at the Fund Office. Before we get started with tonight's presentation, I just want to show you how to go about asking questions during the webinar. If you're on a desktop or laptop computer, there should be a chat box to the right-hand side of your screen. If you're on a mobile device, there is a circle in the bottom right-hand corner. You're going to click on that. It'll bring you to our chat box. Type your message in there. When you're done, click the X in the top left-hand corner, and it'll bring you back to our webinar. All questions will be answered at the end of the webinar during our question and answer period. If we don't get to your question tonight, it may have contained some personal information and somebody from the Fund Office will contact you about it. With me tonight, we have an introduction from Bill Sproul, the Executive Secretary Treasurer of the Eastern Atlantic States Regional Council of Carpenters, and Joe Obahowitz, the Fund Director. And then we'll bring on Mike Wagner, the Health Fund Manager, who will go over the new Eastern Atlantic States Health Plan. And then for the question and answer period, we'll bring back on Bill, Joe, and Mike to answer your questions. With that being said, I will turn it over to Bill to get us started.
Good evening, and thank you for joining us. I'm Bill Sproul, the EST for the Eastern Atlantic States Regional Council of Carpenters, as well as co-chairman for both Philadelphia and Northeast Carpenters Funds. As you may have heard, the Philadelphia and Northeast Funds are merging on January 1st, 2023, and will now be called the Eastern Atlantic States Carpenters Benefit Funds. As I've mentioned in previous webinars, this merger will strengthen our financial position, offer greater efficiencies, and allow us to use our economies of scale for better pricing from providers and professionals that get passed down to your benefits. Tonight is our final webinar about the merger and its impact on your benefits. The Fund Office will give you an overview of the new health plan and provisions and any notable changes. These changes will impact you and your family with the new benefits starting on January 1st, 2023. Please pay attention, ask questions as needed. If you didn't get a chance to join our previous webinars relating to the changes to your pension and your annuity plans, you can watch them on the Fund's YouTube channel. Once again, thank you for watching tonight's webinar, and I look forward to answering your questions at the Q&A. I'm now going to turn it over to Joe Obahowitz, the Fund Director, to begin the presentation.
Thanks, Bill. I'm Joe Obahowitz, the Fund Director of your benefit funds. As Bill mentioned, the webinar tonight is going to focus on your new Eastern Atlantic States Health Fund. As a participant in the new Eastern Atlantic States benefit funds, the former Philadelphia and New Jersey members will now be under the same benefit structure after January 1st, 2023. You may have already seen some of the information that we're going to review tonight, either from the merger notification or on our website. Our goal tonight is to begin the process of explaining to you some of the new terms, benefits, and concepts of what you can expect moving forward. As always, the best way to stay informed with your benefits is through the Fund's website and mobile app, where you can read about your benefits and check your hours on the member dashboard. Also, be sure to check out the monthly newsletters and our social media pages via Facebook and Instagram, and also check out the Fund's YouTube channel for informational benefit videos. So thank you for joining us tonight, and now I'll turn the mic over to Mike Wagner, our Medical Department Manager, to start the presentation, and I'll see you at the Q&A.
Thank you, Joe. Good evening, everyone. My name is Mike Wagner. I'm the Medical Department Manager for the Fund Office. Tonight we're going to go over your health plan, the changes for January 1st, and what you're entitled to under the new Eastern Atlantic States. Our agenda for the night is our important resources, namely our member dashboard, your hours and how important they are to really everything, and why you need to track those, how to do so, your active healthcare coverage, eligibility, and the coverage you're entitled to, the retiree eligibility, which is a goal of everyone working, maintain your coverage through retirement, or if you're joining us tonight as a current retiree, some of the changes that are going to take place for January. Our survivor benefits in the event you pass away before your spouse or dependents. And last but certainly not least, our preventative care measures, how you can use your benefits to make sure you're taking care of yourself in the right way. And then last, and we know it's a lot of information, you're going to have questions. Hopefully you've watched our changes videos and you have questions from there. Make sure, like Cassie said, you're typing those into the chat feature. Make sure we can answer them when we get to our Q&A panel. The member dashboard is probably the most important resource to you as a participant, as opposed to the fund website, which has all of our benefits listed. This is actually your information particular to your case. So you see your regular census information. In the bottom left corner is your health and welfare eligibility. We're going to get into our benefit periods. If you want to check if you're eligible for that based on your hours, you come to My Profile, you click on it, it's in the bottom left. In the bottom right, you see your annuity and your pension information. One caveat with the changes we're making, there's a chance that that's not going to be updated for January. But once we get that updated, those numbers are right, that'll be displayed for you. Make sure you're logging in to check that so you know where you're at on your variable pension that Eric mentioned in our previous webinar, where your annuity accounts are. And lastly, and I saved this for last because of how important it is, top right corner is our work history menu. That's going to show you every employer who has contributed on your behalf, and also any employer that hasn't. Obviously they're not going to be there. You want to make sure, a reminder, your hours drive everything. So we're going to get into a couple of slides about why the hours are important to health and welfare. If you saw the pension and annuity webinar, you know that that's driving your pension years. Check your hours, check your hours, check your hours. We can't say it enough. They're the most important thing to everything benefit related. If you're getting in the habit of checking My Profile, you're looking for your employer, your work history to make sure that the weeks are paid on time, to make sure your monthly hours are paid on time. If you find a discrepancy, it's very important that you treat your benefit hours the same way you would the cash in your paycheck. If your employer cheated you out of 2 days this week, they only paid you for 3 out of 5, you'd never let it slide, right? You'd be knocking on that office door saying, "Where's my money?" If you check My Profile and those hours aren't there, treat it exactly the same way. Submit a form through My Profile, call our collections and hours department, or send them an email. Time is of the essence. The earliest you let us know that you're missing something, the sooner those guys can get to work in terms of getting that money back for you, getting the benefits back for you from your employer. So please, if you find a discrepancy, make sure you're reporting it. Make sure we can go look for those hours so you're getting your credit towards your health, towards your pension plan. If you do find a discrepancy, a primary reason for that may be missing a reciprocal form. If you're a Philadelphia-based carpenter right now and you were working over in New Jersey, or if you're a Northeast carpenter and you're working over here in Philadelphia, you may be used to filling out a reciprocal between the two of us to make sure those hours come back each month. Going forward, because we're going to be Eastern Atlantic, we're going to have one database. Those hours are all going to be merged together, so you'll be able to see them in one location under My Profile. So you won't need a reciprocal between what will now be our Eastern Atlantic states family. I do want to point out that even though the fund is Eastern Atlantic and our union is Eastern Atlantic, there's still 4 other funds that you're going to need a reciprocal form if you're working in the council's jurisdiction. That's going to be Western Pennsylvania, the Pittsburgh area, West Virginia, Baltimore and Washington, D.C., and then also if you're going up to New York City, we know a lot of members are traveling to New York City, you want to make sure you have a reciprocal on file there too. But like I said, if you find a discrepancy, first step, call our collections and hours department. They can walk you through whether or not they need to reach out to the employer or if it's simple enough just to get a reciprocal form on file. Another form you want to be paying attention to on the website, it's our annual enrollment or our coordination of benefits form. It must be filled out every year even if nothing has changed. That's been the rule in place for about a decade. It's going to stay the rule under Eastern Atlantic. We are going to move it. You may be used to getting this in the springtime, filling it out and making sure it's back to us every March or April. Because of the merger and everything that's going on, we didn't want this feature to get lost, so we're going to move it back into the summertime. Cassie mentioned our newsletter and our emails. You'll get notified when this is coming out, but make sure you don't skip it. Why it's so important? Number one, it keeps the fund up to date with all your census information. It lets us know if you have another coverage. If you're a spouse and you have your own coverage if you're working, if you're covered through your spouse's coverage if you're a carpenter, or if your dependents have other coverage, it lets the fund know who should be paying in what order. Also, more immediately, it will put your vacation check on hold if that's not on file. So again, even if nothing's changed, make sure you're watching out for that form and make sure you're filling it out. Another important form is going to be our beneficiary form. A beneficiary is who's entitled to your benefits in the event that you pass away. There are benefits under the health fund. There's a lot of benefits under your pension fund. The reason you want to fill out a beneficiary form, and get in the habit of checking this once a year. Check it. If it needs updating, fill out a new one, make sure it's on file with the fund. The health fund does not default to your spouse or dependents. It's whoever your named beneficiary is. So make sure, again, when you fill out your COB, log in, check your beneficiary, make sure it's up to date, make sure it's accurate, so in the event you pass away and there's benefits to be paid out, we're making sure it's going to the party that you really intended it to go to. I do want to mention our vacation benefit. This is important. It's still going to remain CBA driven. So if you're working in Pennsylvania, it's an employer paid benefit. If you're working in New Jersey, it's in a deduction and comes through. But I want to bring up that it's going to change effective January. We're going to go from a quarterly or a semi-annual, depending, vacation payout. It's now going to be done monthly. But you want to make sure you see that second bullet point there. It'll only be paid out monthly if you have direct deposit set up with the fund office. So again, get in the habit of going to my profile, make sure that the right direct deposit's on file with us. That way we can pay this out every month, assuming that your COB is on file. If we don't have direct deposit on file, it's only going to go out to you one time a year. So again, go to my profile, make sure we have the right direct deposit. Before we get into our active coverage, I'm just going to say it one more time. Check your hours, check your hours. I can't stress it enough. They drive everything. They're going to drive what we're going to get into. Make sure you know that your hours are coming in, your employer's being honest, and again, report it if you find any discrepancies. The next piece, and this pertains to our active carpenters that have joined us tonight. If you're a retiree, I'll get into what in here might impact you, but this is for our active working carpenters and our coverage effective January. It's primarily broken down into 6 separate areas: independents for our major medical, mental health consultants for behavioral, Express Scripts for our prescriptions, our dental benefit through Cigna, our vision benefit through Davis, and then what we call our in-house or our fund administered benefits. That's what we handle here at the fund office. We're going to get new ID cards. You'll get a separate mailing letting you know which ones to expect. And I apologize, I know that's a hassle to have to get ID cards, new ones, to have to make sure they're all updated. But make sure you're opening those envelopes as December goes along. Make sure you have those cards on hand. Your cards won't work if you're using the old ones. I know we got in a habit, a lot of us have using our Medco cards for our Express Scripts benefit. All the numbers are going to change, so you want to make sure you're opening your cards. Make sure you have those new ones ready to go for January. But we wanted to bring up the apps because honestly, that's the best way to make sure you have those cards on file at all times. So you see their icons here. They're always available on carpenters.fund if you need a reminder. Make sure to download these apps. Add your cards to your Apple or your Google Wallet. That's really the best way to make sure that they're there, that you have those numbers. Download these apps come January so you have that information handy. For our benefits, 3 important things you need to know: it's your benefit year, your eligibility periods, and your work periods. The benefit year is going to be April 1st through March 31st. 2 corresponding eligibility periods: April 1st through September 30th, October 1st through March 31st of every year going forward. To be eligible for those, the work periods, to be eligible for April is going to be July to December. To be eligible for October, January to June. An important thing here I want to point out for our Philadelphia-based carpenters coming in under the merger, we know that this moved everything up by 1 month, including the last month we normally have to work in order to qualify for spring. So for April in particular, April 1, 2023, the fund office is going to automatically review the new set of eligibility for work periods and also the old set. As long as you meet the hours under one of the 2 rules, new or old, we're going to automatically make you eligible for April 1st. But going forward, get in the habit of knowing these periods, knowing when you need to be working in order to make sure you're staying eligible. We're now going to have 2 levels of coverage. It's our gold level, which is a 90-10 coinsurance plan, and our silver level, which is a 70-30 coinsurance. That's the primary difference between the 2, but really the driver of how you end up in one or the other is it's going to be hours based. So for gold, it's going to be different hours. If you don't quite meet it, you'll get silver, which again is a 70-30 coinsurance plan. I used an important term there, coinsurance. I just want to very quickly go over what we consider the key health insurance terms. If you're not familiar with these, don't feel bad. We hear a lot of confusion when we get phone calls. I think there's a study out there that says 50% of Americans can't accurately articulate each one of these and how it applies to them. So we want to make sure we bring them up so you know what you're up against. The first one's going to be your deductible. You may be familiar with your deductible because most of our auto insurance policies have a deductible. Our homeowners has a deductible. A deductible is you have to pay the first dollar up to a certain threshold before the plan will kick in. I bring this up because it's important to point out that for in-network benefits, and that's important, in-network with each vendor, in-network benefits do not have a deductible under our plan. Our plan is first dollar, so the fund will pay, if it's 90/10, we'll pay our first dollar on your first claim. 90/10 coinsurance, what is a coinsurance? That's how much you as a participant have to pay, and it's broken into two categories, coinsurance and copay. Coinsurance is a percentage base, so it can change. So if you go to one urgent care, it might not be the same as another urgent care. Your copay, and that's going to be on our prescription plan, those are flat dollars. So if you get a generic, it's always $5. It doesn't change. Our out-of-pocket maximum, and sometimes we do hear this confused with deductible, that's why I wanted to bring it up. Our out-of-pocket max isn't you having to pay before the fund does, like a deductible. This is the most you can pay before the fund pays at 100% for the remainder of the plan year. That's considered your out-of-pocket max. We'll get into an example of that in a couple of slides. But let's go over gold level. Gold level, again, hours based. So you want to be working in that 6-month time frame that we pointed out, 600 hours if you're a commercial carpenter, or 1,200 hours in a 12-month time frame. For New Jersey shop and casino, or Eastern Atlantic, what's called light commercial, you're going to work slightly higher hours, 850 in 6 months, or 1,700 in 12 months. Assuming you meet those thresholds, again, it's a 90/10 coinsurance. That's for our independence medical and our mental health behavioral benefits combined. We combine them for out-of-pocket purposes. That's why they're both listed there. But both, if you're using an in-network provider, that's important. Find in-network providers for medical through independence, or simply ask them if they take Blue Cross. For mental health consultants, you want to contact their number or visit their website to find their list of participating therapists, counselors, inpatient rehab facilities. Assuming you're using those, it's going to be a 90/10 plan. Quick example, I'm going to use easy math here. If the allowable amount of an office visit, let's say we're $100, in that case, 90/10, the fund's going to pay $90. You as the participant are going to pay $10. Now that's an easy example when I use an office visit that costs $100, but what if you have a knee surgery? What if you have a new baby? And those bills start to go into the tens of thousands or the hundreds of thousands. All of a sudden, 10% becomes a lot of money. This is where the out-of-pocket max comes into play. So the out-of-pocket maximum runs every benefit year, April 1st through March 31st. If you're covered under the gold plan, it's going to be a $1,000 maximum for an individual, $2,000 for a family. I want to point out $2,000 for a family doesn't mean if you're a family unit that you have to pay twice what a single guy would. Inside of a family, one person could have met their individual max, and the fund will be paying their bills at 100% for independence and mental health for the remainder of the year. But if you had 4 members of your family and each one had a $1,000 bill, only 2 of them had to pay, and then the whole family is considered maxed out. That's how that benefit works. If you're confused about this, there is a YouTube video going over how the out-of-pocket works. Make sure to watch that so you know how this plays in. Just as a quick example so we can see it in real numbers, let's say the charged amount for a knee surgery is $75,000. The independence allowable rate, that's how much the insurance has negotiated. They're going to do this on almost every claim. They never pay what the doctor wants. They're going to have their own set rates. And that's what our coinsurance is based off of. So if the allowable were $60,000, if we were strictly under a 90/10, you figured you'd have to pay $6,000 out of pocket for this. But because we have the out-of-pocket max in place, if this were the first claim of the year just for ease, the fund would pay $59,000. The participant would pay $1,000 and be considered maxed out. So for the remainder of the benefit period, the fund would pay all other medical bills at 100%. You'd have nothing else out of pocket. An important feature of the gold level that the silver level does not get is our dental and our vision benefits. Our vision benefits through Davis Vision, it covers an eye exam for every participant. And when I say participant, that's member, spouse, or dependents covered at 100% in network with Davis Vision. Remember that term, in network. If they're in network with Davis Vision, we pay at 100%. You get a $100 allowance for frames and lenses or contacts. For your frames and lenses, your glasses, if you use VisionWorks, you'll get an additional $50 to help purchase those. And again, it's covered once a year for member, spouse, or dependent. Our dental benefit through Cigna is very similar to our medical plan. It's a 90-10. So whatever Cigna, again, in-network Cigna allows, the fund's going to pay 90%. You as the participant are going to pay 10%. Each year from April 1st through March 31st, you get $2,500 family allowance. We didn't want anyone to skip their 6-month cleaning, their 6 months exams as a result of that 10%. So if you're going for preventative or diagnostic care, cleanings and x-rays, we're going to waive the coinsurance. The fund will pay that bill in 100%. It is important to point out that still comes off the $2,500 annual family allowance. But in that case, you won't pay the coinsurance. And lastly, we do have an orthodontia benefit. It's $3,200 per person per lifetime. That's separate from your $2,500. So if you have 2 kids in braces at the same time, they're both going to get $3,200. They're not going to be eating away at your $2,500 that you use for exams, x-rays, crowns if you need them. That's the gold plan in a nutshell. So what is the silver level? Like I mentioned, it's slightly different because you're working less hours. But the good news is, especially if you're coming from Philadelphia, you're not used to having this, we had to work 600 hours or no benefits. This will be a second tier if unfortunately you don't make that coverage. So if you're a commercial carpenter, you're working 450 hours in 6 months or 912, you'd still have a level of coverage here with the silver level. If you're a Northeast shop or casino or in Eastern Atlantic states, light commercial, in that case slightly more hours, again it's 650 in 6 months or 1,300 hours in 12 months to qualify. Because you worked lower hours in that working period, the coinsurance is going to be slightly higher, still the same coverage, so no difference in what independence and mental health are going to cover, just a higher coinsurance. This plan is a 70-30, so you're going to pay a 30% coinsurance as opposed to a 10%. Now again, 30% could stack up in a hurry, so just like the gold plan, the silver plan has an out-of-pocket maximum. It's just twice the amount. So $2,000 for an individual, $4,000 for a family. Now the question is going to be, what do you know, how do you know what to pay once you go to a doctor or you go to a counselor? For each claim that you encounter, you're going to get what's called an explanation of benefits, or an EOB. That's going to list what the insurance allowed and how much you have to pay. You want to make sure you're checking these for 2 reasons. Number one, as you can see on the screen here, it gives us our billed amount. It gives us our independence allowable, in this case $127 for this particular physical therapy. This will tell you what the plan paid, so we paid 90%. This individual was covered under gold, and what they have to pay, $12.70, or their 10%. Additionally, it's going to tell you down there at the bottom where you're at toward the annual out-of-pocket. So get in the habit of checking these just so you know when you get a bill, number one, should you pay it? Number two, are you charged correctly? Also, where you're at towards your out-of-pocket. But then get in the habit too, not just of reading that cover page. You want to read this second page as well, because this is going to give you a line item breakdown of what the provider billed and what the insurance paid. You want to read this primarily because if something was denied, if independents denied a benefit for one reason or another, they don't go back and do an automatic review. We hear that a lot. The insurance will just take care of it. If they denied something, they assume that either you or the provider is going to respond with what they needed for the denial. So if you see a denial on here, call independents to find out what you need to do to get it covered, or call the fund office. We can review it with you also. But make sure you're opening these EOBs, getting used to how to read them. What's covered under both levels for gold and silver regardless? The first one we want to start with is our telehealth app called MD Live. I bring this up because it primarily relates to what we just went over, independence administrators and mental health consultants. MD Live is an app that you should have on your phone. We will need to re-register. If you've already registered or used MD Live, that's great. Because we're going to get new ID cards, we are going to have to re-register January 1st. So make sure you download the app, make sure you're registered for it. The reason being is MD Live functions primarily like a substitute to the urgent care. If you're at home with sick kids that can't go to school, if you're on the job site and have a sore throat, you need an antibiotic, but you don't want to come off the job site and lose those hours. If you're traveling and can't see your regular doctor, you can see a doctor on your phone or your tablet. The best part is they can call in prescriptions, and also they don't charge you a coinsurance. It's completely free to you as the member. Beginning in January, you can now also find a therapist for behavioral health if there's not an in-network provider through MHC that's available, or if you're just more comfortable doing it from your house, make sure to have this app, talk to the people that you need to talk to. Also, dermatology is going to be covered. So if you have suspicions about a freckle or a mole, you want an opinion without going to a brick and mortar dermatology or the wait's too long, have MD Live downloaded come January. Additionally, under both levels is our prescription benefit through Express Scripts. We know how important medicine is to the prevention of disease, to the treatment of disease, so we wanted to make sure both levels had Express Scripts and there was no difference. Where you're paying a higher coinsurance if you're under Silver, benefits are going to be the same regardless of your level for prescriptions. Very quickly, what it is, copay generic plan. We advise everyone to be on a generic if you can. Number one, it saves you money. The copay structure, 30 days, $5, 90 days, $10. If a copay, or rather a generic, is not available, you're on a brand drug. They're split into two types, preferred and non-preferred. Express Scripts has brands on their formulary that they want you to be on. If you're on a preferred brand, it's 25% of the cost, but I don't want you doing quick math saying, well, what if my drug's $1,000? Do I all of a sudden pay $250? It's 25%, but it's maxed out. So for 30 days, no more than $75. 90 days, no more than $150. I tell people all the time, if you're not paying one of those numbers you see listed here, 5 or 10 for generic, no more than 75 or 150 for brands, there can be a couple of reasons. You could be on a non-preferred brand drug, in which case you're going to pay a lot more than that. You see to the left of your screen, 90-day supplies are only ordered in one of two ways, either through Express Scripts mail order or by walking in or driving through any CVS. If you're at a Rite Aid and you're filling your fourth time, you're at a Walgreens and filling your fourth time, in that case, you're going to run up against paying 100%. Or the right icon if you're on a specialty medication. Those are very expensive. We have a specialty pharmacy of our own called a Credo through Express Scripts that manages that. If you're paying anything other than 5 or 10, no more than 75 or 150, you probably have run afoul of one of those areas. Call the fund office. Call the fund before you pay, before you put the money on your HRA card. It's usually something as simple, like I said, you're filling your drug at Walgreens, you just need to move over to CVS. We can help facilitate that. We can make sure that you're doing the right thing so you're not getting overcharged. An important change, this gets into our in-house, our fund-administered benefits, the primary one being the ambulance coverage. Our ambulance coverage is going to change if you're a Northeast Carpenter. Right now it would go through Independence Administrators. If you're a Philly Carpenter, you might have taken an ambulance ride, you know to send that bill down to the fund. Effective January, all ambulance, ground ambulance bills should come to the fund office. The fund will reimburse $1,000 per trip. The goal is most ambulance companies are local based or they're volunteer based. They'll see the $1,000, they'll take that as payment in full, they won't charge you. If they do, it's important to know that you can't pay more than $1,000 out of pocket in a given plan year for an ambulance ride. Quick example, if you take a ride, it's $3,000, they refuse to budge. They would get $1,000 from the fund. Most you can pay as a participant is another $1,000. After that, make sure that bill comes back to the fund office so that we could pay, in this example, the additional $1,000 to make that whole. I do want to point out air ambulance, a helicopter ride for medical reasons is completely different. Those claims processed differently. There's different safeguards around that. So for that reason, that does go through Independence Administrators. I'm going to go back to the slide about the EOB. This is why it's so important. If the ambulance ride just bills Independence Administrators, you're going to get an EOB that says that's denied and it's, quote, carved out to the fund office. If you see that, make sure that you get that bill down to the fund. Make sure we can take care of it for you. That's all the ways that you can come out of pocket for treatment as a participant. One of the ways we have to help you with that is our HRA account, our health reimbursement. It's still CBA driven even under the merger, so depending on where you're at, different rates are going to go into it. But we're not changing the administration of it. You will probably get a new MasterCard. Those will be coming out in December. There's a few different ways to access it. It's the MasterCard, the web portal, and the smartphone app. What's the difference between those things? The MasterCard you can use right at point of sale. So if you get a bill for your 10% coinsurance, if you're at the pharmacy and have a $5 copay, swipe the card right away. That's always our recommendation. In the event you forgot the card or you didn't add it to your Apple Wallet, if you pay out of pocket, upload the receipt either through the web portal or the mobile app. Traditionally, the fund will reimburse you direct deposit within 2 weeks. So again, make sure that you have a copy of that Blue MasterCard. Make sure you're opening your mail in December to get a new one. But if you do pay out of pocket, those are your two options for getting reimbursed. I want to bring this up because it's a change to our HRA. Just a reminder, we used to not allow the vision benefit and the dental benefit to go through your MasterCard. Those two are eligible for the MasterCard. So if you go to VisionWorks and you get a second pair of glasses that aren't covered, or if you're paying your 10% Cigna bills, make sure to use the card. Make it easier on yourself so you don't have to come out of pocket for those two. For our survivors, if you're an active participant and you pass away, unfortunately, early before your spouse or your dependents, you're eligible for an active death benefit. It's payable up to $35,000 as long as you were eligible for health benefits when you passed away. This, again, why it's so important that you write down who you want your beneficiary to be, because it does not default to your spouse and dependents. We've seen the horror stories before where we had a guy fill out the 4-H club. We had to pay the 4-H club the $30,000, $35,000 because that's who he told us to. So if you have a spouse, a dependent, a brother, whatever it is, make sure that's who you're writing down. Make sure that the fund office knows that. If you do have spouse and dependent on file and you're eligible for benefits, they will remain eligible under the fund for an additional 12 months in the event that you pass away as an active covered carpenter. Two benefits somewhat similar, but I do want to make sure that you're aware of it as an active working carpenter. It's our disability benefit and our supplemental work comp benefit. What those are, I mentioned, your hours are so important. You need those hours to stay eligible for health. You need those hours to be contributing to your pension plan. If you're hurt off the job, you're not going to be getting paid by work comp. You're not going to be getting paid in general. Even if you have an AFLAC policy that's helping with the bills, no one's contributing your hours. So you want to apply to the fund office. We will contribute 30 hours toward health, 30 hours toward pension. If you're a shop guy or a light commercial guy, it's going to be 33 to make sure you're hitting that additional hours threshold. Additionally, because you're not getting paid by work comp, it comes with $550 per week. You can be on this benefit for up to 2 years if the doctor keeps you out that long, says that you can't go back to work. One important thing to mention beginning in January, New Jersey does have state disability. We're going to ask that anyone applying for disability apply for state disability through New Jersey, even if you never worked over there. If you do get coverage through New Jersey, our 550 is going to be offset. Quick examples, if you spent your whole time working over in New Jersey, the max is $600 and some odd. I'm going to use $600 to make it easy math for myself. Let's say New Jersey gave you $600. You're eligible up to 6 months under the state. For those 6 months, you would get the 30 hours from the fund. You wouldn't get anything financial because you're getting it all from the New Jersey state. At the end of the 6 months, if you're still covered, the doctor still keeps you out, you're going to get your 30 hours plus we'll pop you up to our 550. If you worked half your time, the state's only giving you 300. In that case, you'd get 300 from the state, 250 from the fund, and those hours. If you're working your whole career over in Pennsylvania, so you're not eligible, the state denies you, in that case, right out of the gate, 550 from the fund, 30 hours. So that's how that's going to work. We're going to ask everybody to apply. Our supplemental worker compensation is slightly different because you are covered, you got hurt on the job, you are covered under your benefits through your employer. That doesn't come with the 550, but it does come with the hours. So again, if you're hurt, make sure you're applying to the fund. I do want to point out the difference between the two is your eligibility. For disability, you have to be eligible the period you were hurt plus the previous one. So it's so important to make sure you're getting those hours, making sure you're staying eligible. For workers' comp, it's just the period that you were hurt in. That's the difference between those two. But make sure, again, if you're hurt, you're calling the fund office, you're making sure to apply. That's our active coverage in a nutshell. I go through it pretty quickly. We have a lot of benefits. Again, if you're worried about the changes coming for January, make sure to view our YouTube and see what changed. Make sure to go to carpenters.fund. You'll see all your benefits listed there. But now let's get into the goal. We're hoping to retire with healthcare coverage. Or if you're joining us as a retiree tonight, here's how it's going to change for you come January. The first thing, and again, this only impacts the guys who are working toward retirement, not our current retirees, but we're going to move effective April 1st to what we call a credit system in order to be eligible for retiree healthcare coverage. I want to go over the eligibility periods quickly because that's what it's going to be tied to. Reminder, it's April 1st through September 30th going forward, and October 1st through March 31st. The reason that's important, under the credit system, you're going to need 30 credits in order to retire with retiree healthcare coverage. The most you can get in a plan year is going to be 1 full credit. And the way that that works, going back to those eligibility periods, if you hit a gold period, it's going to count as half a credit. A silver period, because you had lower hours, it's going to be a quarter of a credit. Unfortunately, if you miss eligibility, you're going to get 0 credits, but you can make that up. You don't need 1 year, you can get a quarter of a year, you can get a half a year. The one question we've gotten as we've gone over this is, I worked part-time in a Philadelphia local and I transferred to New Jersey or vice versa. Are they going to be combined? The answer is yes. So your legacy history is all going to be calculated automatically, and we'll start applying that toward the credit system. Once we get through the merger, we're working on having this display on your My Profile screen, so that way you'll know where you're at toward your retirement and the goal of retiring with healthcare coverage. If you're joining us tonight as an already retired participant, the one thing that you want to pay attention to primarily, and again, this is available on the website, this is available on YouTube, the changes that are going to impact you are pretty minimal. It's going to be, if you're a Northeast retiree, our prescriptions change to that side that we just went over. If you're a Carpenters Benefit Fund participant from Philadelphia, it's that our independence out-of-pocket max dropped. Right now we're $2,000. Beginning in January, we're going to be that gold plan. It's $1,000 per year. The impact to both, regardless of where you're coming from before the merger, it's that ambulance benefit change. So again, if you have questions, call the fund, visit the website, rewatch the webinar tomorrow on YouTube. That was for the pre-Medicare retirees. If you're Medicare eligible and joining us tonight, we do just want to quickly call out a change coming for January 1st. Or if you're looking to retire in the next 5 years, let's say, and you're closing in on your 65th birthday, we want to make sure you know how Medicare comes into play. So the first goal is retire with healthcare coverage. Not much changes. You're still covered similarly to how you were for active coverage. Medicare is the first time that you really see an impact. And you're going to be auto-enrolled, typically when you turn 65. It's split into 2 parts, Part A and Part B for your medical. Part A is your hospital and everything associated with it. Part B is really everything else, doctors, blood work, ambulance. Part A has a very high deductible if that was the only coverage you had. Part B is an 80-20 coinsurance. For that reason, we do move you to Medicare when you're 65 and eligible for it if you're covered under the fund's health insurance. But we move you to a Medicare Advantage plan through Blue Cross. So still the group that we're used to, it's just their Medicare Advantage package. And what that does is it covers all your Medicare Part A and Part B coverages at no cost to you as the participant, other than your Medicare premium through the government and your premium to the health fund. The other part that's important, and this is the one that's changing for January 1st if you're already on Medicare and retired, is your prescription benefit or your Part D for drug. The prescriptions beginning January 1st for Medicare eligible participants, it's going to go through Express Scripts, and it's similar to what we have set up for the active plans. So just a quick reminder, $5 and $10 generics, 25% brands, but again, no more than 75 max for 30 days, 150 for 90 days. Your copay, when you do retire, you are going to pay a copay out of your pension to the pension fund to keep you covered for healthcare coverage if you retire with healthcare. For current retirees, those copays are going to stay the same as what's being deducted right now, no change, and it's based on your pre-merger fund. For retirees coming in January 1 and later, it's going to be based on what the premium is under your pre-merged fund. So if you're from Philly, it's whatever the Philly premiums are to stay covered under healthcare. If you're from the Northeast, New Jersey, in that case it's going to be whatever New Jersey charges for the healthcare coverage. So that won't change as a result of the merger. Again, if retirement is on the horizon for you and you're worried about your healthcare coverage, call the fund office. We can go over what those costs are going to be. When you do retire, there is what's called a run-out period of your coverage. So in order to retire with healthcare coverage, you have to be eligible in the period that you're retiring and the period prior, just like our disability benefit. You have to be eligible the period that you plan on retiring plus the period before. But assuming you meet that, assuming you met that credit requirement that we just went over, there will be a run-out period before you have to start paying your premiums. So if you retire, you're eligible without paying for the benefit period we're in plus one benefit period. An example of that, if you retired at the start of the benefit period April 1st, you'd get April through September, and then you'd get the next benefit period again without paying, October to March. Your premiums would kick in that following April. If you wait a couple of months, you retire in July. In that case, you'd get July, August, September without paying, plus the October benefit period. So that's how that impacts you. But what if you don't qualify for coverage? If you come in to retire and you didn't meet that credit period, there's still a protection so you don't immediately have to go out and find your own coverage. As long as you're eligible for benefits when you retire, but you didn't meet the retiree health care, in that case, you're going to get the remainder of the benefit period that you're entitled to. Again, if you have questions, call the fund office. If retirement's on the horizon in the next couple of years, call us so we can walk you through that. If you didn't qualify for coverage, and this is for retired or active participants, if you just missed the hours, you didn't qualify for silver, so you don't have coverage at all, there is a protection called the COBRA plan. COBRA follows the rules listed by the government. It's a government program, but you stay in the fund's benefits. You do pay for them. You pay what the cost is to the fund to sponsor those benefits, but a member can do so for up to 18 months. Spouse and dependents can do so for up to 36 months. For COBRA, you don't need to call the fund office to let us know. We obviously know you're losing eligibility. Those letters come out automatically. If that's the case that you lost coverage, you would see that come in, and then in that case, you coordinate with the fund to make those payments to stay on coverage if you choose to do so. Our survivor death benefit's slightly different. The active death benefit comes with the health financial payment. For retirees, the survivor death benefit pertains to your coverage. If you're pre-Medicare, your surviving spouse and dependents would get the remaining 12 months of coverage, and then they would start paying COBRA. If you're already on Medicare, your spouse would get to pay the premium for 12 months, and then they would pay slightly higher. The premiums are subsidized. They would pay slightly higher because they would lose the subsidy, but they can pay for that premium for life, so they don't have to go find new Medicare coverage. A reminder about the HRA, because this is important when you retire. If you're paying COBRA, if you're paying your premium, if you're now on Medicare and you're paying that premium to the government, you can use your HRA. That's often a question we get. What happens to my HRA when I retire? So when you're active, you're loading in those contributions year over year. The HRA is not like an FSA where it's use it or lose it each year. The HRA follows you into retirement. You're building it up, hopefully, because as we retire, we get sicker, we have more prescriptions. You want to make sure that this cushion's available to help cover that. But again, it does help cover your premiums, and in the event you pass away and there's still a balance, it can be passed on to your spouse or your eligible dependents if they're under age 26. Same as I said for the active coverage, we fly through that, the retiree coverage. If you have questions, make sure you're putting them in the chat so we can get to them on the panel. Make sure you're visiting carpenters.fund or rewatch any of this portion on the webinar either tomorrow, or if you're home on Black Friday and feel like learning about your benefits, rewatch it so you know the pieces that are important to you. The piece that's important to us as the fund is your preventative care. You see the quote there, an ounce of prevention is worth a pound of cure. An ounce of prevention, as we see it, is worth a healthier life, a longer retirement, a happier life. Let's get into how the fund has programs that you can utilize to make sure you're doing that. The first one, and it's a big one, is our physical program. We have two options beginning in January. It's the Patient First Physical, or through Robert Wood Johnson. If you're in central or northern New Jersey, that's a hospital chain in Edison. We offer physicals through both. You can walk right in. We're still waiting on some information for Robert Wood Johnson to get that finalized. Cassie mentioned our newsletter. Make sure to keep an eye out. We'll make sure that you know how to utilize this benefit once we officially get it up and running. Patient First will be up and running on January 1st, so if you want to spend your New Year's Day getting a physical, feel free to do so. Walk into any Patient First or an urgent care, primarily around Philadelphia and South Jersey. They have locations as high as the Hamilton train station. Walk in, get your comprehensive, know your numbers, know where you stand from a health perspective. If you do so, either Patient First or Robert Wood Johnson. For members and spouses, we will send you a $25 gift card. Currently, we do them available to Target. The gift cards are member and spouse, but a physical is available to any member, any spouse, or any dependent age 16 and up once a year. Okay, so make sure you know that. Make sure you're going to get these done. The other important screening is our ColoFit test. This one's important because of how relevant colorectal cancer is primarily to the carpentry industry. We're higher than the American average, and because we're male dominated, at least from the working member perspective, unfortunately colorectal cancer targets men more often than it does women, and it's important to catch it. Not this cancer in particular, all cancers early, but we focus on this one because of those numbers you see in the bottom right corner. They say 1 in 5 Americans, if we have 300 people on the webinar tonight, figure that math works out statistically to about 60 people could potentially have colorectal cancer in their lifetime. For that reason, go to carpenters.fund, sign up for the kit. The kit comes to your house. You do it right at home, send it back. This company can tell you if you have early signs, they can help you detect that early. And the reason that we want you doing this, why it's so important, if colorectal cancer and a lot of cancers are caught early, the survival rate is in the 90%. So 9 out of 10 people can survive that. That's huge. If you wait, and again, sadly, through our disability benefit, we hear this all too often. I knew something was wrong. I delayed it. They caught cancer late. If it's caught late, instead of 90% survival, it drops into the 20s. That's terrible. Get the kit. Make sure you're filling it out. You're eligible for it once a year. Do it once a year. Make sure you know where you stand. If, God forbid, the cancer diagnosis in your future, you're catching that earlier, you're in that 90% that survive it. Additionally, 2 screens sponsored through Temple Health. Temple is primarily based in Philadelphia, but they also have 5 locations all around the counties that are hopefully easy accessible for everybody now under Eastern Atlantic. It's our Temple Heart and Lung scans. They are free to eligible participants, so you're not paying a copay. You're not paying a copay for Patient First or Robert Wood Johnson, ColoFit, or this benefit. They are age tiered, and this is based on medical policy. So your heart scan is radiation. It's looking for calcium buildup in your arteries. Your lung scan radiation as well, looking for early signs of cancer. Because of that, we don't want members going through them just because. So it's based on medical guidelines, women beginning at age 50, men at age 40 every 3 years. Primarily women are healthier than men, so it's a decade later. But I want to bring up, if your job site, and we know that carpentry job sites are like this, if they put you at a higher risk of lung cancer, constantly around sawdust, if you were ever doing asbestos removal, or if you have a family history of heart or lung, call the fund office, call Temple. They will get you in early. We don't want to put up any barriers to someone who needs this to help potentially spot something life-saving. So again, call us, know when you're eligible for that. Put a reminder if you're age 40 to make sure you're doing that. 2 things, if you do happen to come up with a disease, primarily diabetes, that we want to make sure you're aware of. If you're a diabetic, testing is very, very important to know where you stand from your insulin measures. There's a company called OneDrop that will send you all of your supplies at no cost. They will give you a coach if your numbers spike. So we got Thanksgiving in 2 days. If you're diabetic, the numbers go through the roof. A coach would be calling you saying, well, how do we correct this? How do we get back on track for the weekend? Make sure that you're signing up for OneDrop. This is going to be the only way we're going to cover diabetic supplies under the new plan. So again, if diabetes is something you're struggling with, make sure you're familiar with this. Make sure that you contact OneDrop. If you're a diabetic, if you're pre-diabetic, so you went to your Patient First physical and they said your numbers are above a 5.2, I think it is, you're pre-diabetic. Or if you're obese, your BMI is 30 or greater, and you're looking to make a true lifestyle change. We got January right around the corner. You're setting New Year's resolutions. If you're really looking to change your disease standpoint, we partnered back in the spring with a company called Virta Health. Virta helps customize a diet plan. They will give you all of the supplies you need to test your blood sugar and get you a health coach if you're looking to change those numbers. We've already seen about 150 people join Virta. We've seen some serious success cases we're very excited about. We get nothing but positive feedback about this program. So again, if you're diabetic, pre-diabetic, or obese and looking for a change, please visit our website. Make sure you know that Vert is available to you. The last slide, and I appreciate you guys hanging in with us for this long. Like I said, our benefits are very rich. They're very complex. If you're confused about your benefits in general, if you got recently diagnosed diabetic and you don't know the right drugs to be on or the right programs to join, if you got recommended a surgery and are looking for a second opinion, the fund has what we call our in-house nurse program. They're trained by Temple Health in Philadelphia, but they won't steer you necessarily to Temple. They're looking for locations, number one, that you're going to go to. So if you're up in Edison or North, it's going to be somewhere up there. If you're down in Delaware, it's going to be somewhere in Delaware, or the location that's best for whatever needs you have. But the nurses are here as an advocate for you as the participant. They don't report back to me and Joe. They don't report to the board. They're not going to tell your employer, hey, did you know that Mike's a diabetic? They're here as an advocate to help you understand these complex benefits, the carve-outs that we have, how to best utilize them, and how to know what you're entitled to. We have 2 nurses that are in-house. If you happen to be hospitalized or you go to your patient first, they're going to call you and check on you. We also have 2 nurses that are out on the road. Same thing. If you're in the hospital, there's a chance they're going to pop in depending on your disease and make sure that you know what you need to do while in the hospital, also what you need to do when you get out. Those are all algorithm based. It tells them who to call and who to visit. But again, if you have general questions, don't hesitate. Call the fund office, ask to speak to a nurse, make sure that your questions are getting answered. With that, I'm going to turn it over to Joe to do our recap, take us into questions and answers. I appreciate you guys listening to our benefits tonight about the merger. And again, if you have questions, please load them into the chat. Call us at the fund office tomorrow or Friday. Make sure that we're helping get these questions answered for you.
Thank you, Mike. Let's do a quick closing and recap before we start the Q&A. As a reminder about our communications tools, make sure you're following us on social media, you're reading the newsletters, and checking out the website as needed. Also, to make sure you check your hours drive everything. If there's a discrepancy in your hours, make sure you contact us at the fund office. Understand the preventative health measures and benefits we offer through the fund and make sure you're maximizing them. Make sure we also have the most up-to-date direct deposit information so you can get your vacation payments on a monthly basis. Also, if you haven't done it in a while, make sure you update your beneficiary information on file with the fund. As a reminder about the nurse team that's offered through the fund office, and MD Live is where you can FaceTime a doctor, and the HRA benefit. Understand how all of those can work in your favor through your benefit. Also, reminder to download any notable apps that can help you through the benefits or through the fund. And also make sure recently with any of the changes that you are opening your mail and look for any new ID cards that are going to be sent out. And as a reminder, if you have any questions or concerns, we're always available, so you can contact the fund office at any time. Thanks again for attending, and let's turn it back over to Cassie to start the Q&A.
I hope that was informative for everybody. We are going to start our question and answer period now. Just remember, if we don't get to your question tonight, it may contain some personal information and somebody from the fund office will contact you. I will now bring on the panel to start the question and answer. Okay, hello. We have Joe and Bill and Mike with us to answer your questions. First question. For the first eligibility period, how do I qualify?
Yeah, sorry, we're having small technical difficulties on our side. Cassie, we couldn't hear you on the panel, but it looks like the first question is for the first eligibility period. How do I qualify? So the first eligibility period under Eastern Atlantic states is going to be our April 1st eligibility period. If you're currently joining us as a Northeast Carpenters participant, you're used to that, like I mentioned. So in that case, you're just making sure you're working those hours. If you're coming out of the Philadelphia Carpenters, it's a little bit of a change for us since we're losing that 1 month, since everything moves up a month in that calendar year. So the way we're going to do the calculation, the fund office will do it automatically. We're going to look at the current Philadelphia rules, as long as you qualify under that, or we'll look at the new benefit period and those qualifications, and all that will happen automatically. The number one thing that I'll just repeat, and I know I said it a bunch of times, make sure that you're checking that My Profile feature. That way you know how many hours you have, you know the hours that you need to get in before the end of the year.
Okay. What age can you get the colo fit test?
As we're trying to work out the audio issue here, I guess we can just read the questions here. So the next question, Mike, what age can you get the colo test?
The colo fit test, any age, honestly. Like I said, we don't want to put up any barriers to you guys getting that. So please visit the Carpenter's site, download a kit, and make sure that that's available to you. So we don't have an age limit on that. If you're Medicare eligible, you're entitled to it. If you're an active carpenter, you're entitled to it.
Okay.
Can you guys hear me now? Okay.
Will eligibility dates for vision dental benefits stay the same or reset?
So two-part answer. Will they stay the same? They'll stay the same as in they're guided by our benefit year. But for January, they won't reset. They won't reset until April, the new benefit period. So even though we're merging for January, if your next date isn't typically until April, it'll stay the same.
Okay. Can you guys hear me yet? No?
Still can't hear you, Cassie. Okay. I'm getting married in May of 2023. How can I enroll my future spouse on my existing retiree benefits? Being I pay the same as a married retired couple and I'm single.
Yeah. So first off, congratulations on the marriage plans. If you're getting married in May, you do have to be married. That's important. So you can't enroll a girlfriend. You can't enroll a boyfriend if you're a sister in the brotherhood. But if you're married, you send in a new application. Typically, you could wait for the COB to do so, or just send in your marriage certificate and your new spouse's social security number. Send it in enrollment@carpenters.fund, or just call the fund office and mail us a copy down.
Okay. Can you hear me yet?
Any luck, Cassie? No.
I don't know. My sound is going. So
Yeah, thank God for the vision benefit.
You're right. All right. Here we go. How many years do I need to retire with health coverage, Mike?
With health coverage, it's uniquely based, but under the new credit system, basically 30 is the answer. So you need 30 years or 60 credits. You can go back to that slide, or we do have a YouTube video. If it's not published yet, it'll be up soon. But the reason I hesitate there is for Philly, there's two qualifications. There is a possibility to go out in 25 years. If you're a Northeast carpenter, if your hours were in before 2011, in that case, it's 25 years. So 30 is the short answer, but it's uniquely based. So if you're looking at retirement in the next few years, call the pension fund to make sure you know what you're looking at.
Okay. But 30 is the new normal number.
30
correct?
is the new normal number. That's
30 is
correct.
the new normal.
Yep.
Okay, thank you. The next question is for retiree on Medicare. Are their prescriptions going to be automatically transferred to Express Scripts?
Yeah, that's a good question. So with January coming up, we're going to move from the Medicare pharmacy we're used to right now back to Express. They will automatically do that. So we're working every day right now with the two companies to make sure if you have refills, if you have pre-authorizations on file, all that stuff will transfer over automatically.
Okay, thank you, Mike. As a retiree, if I pass away, can my wife continue to pay for health benefits through the Carpenters past the 12-month time period?
Yeah. So if you're a retiree, like I said, on Medicare, if you were to pass away, yes. So you'll get the 12 months at the premium that you're currently paying. After that, you do pay slightly higher because that premium is subsidized. So you would pay whatever our traditional COBRA rate is. But the goal is that you wouldn't have to go out and look for a new Medicare Advantage plan. So in that case, if your spouse were comfortable staying here with the Carpenters, in that case, she's eligible to do so.
Okay, thank you.
Okay, next question. What if my wife turned 65 before me?
If your wife turns 65 before you, I'm guessing the question is, how does that relate to one individual being on Medicare, one individual not? This happens all the time, be it the member turns 65 first or the spouse does. In that case, it's one person would move to the Medicare group, and we monitor that internally, same way as if both were to do it, and one will stay in place under our independence plan. But again, we monitor that pretty closely. You're going to get a ton of mail. I say it all the time. You'll get a ton of mail in that first year leading up to age 65. Primarily look for the mail from the fund office. We're going to send you information on what you need to provide to us, what you're entitled to, when to get it back to us.
Okay, next question. Are the continuous glucose sensors still through Express Scripts in January?
Yeah, so that's a good question. I mentioned the diabetic supplies going through a company called OneDrop. Continuous glucose monitors, they're becoming more popular. You've probably seen them attached to people monitoring their blood sugar if they're type 1. They're becoming more popular for type 2 diabetics as well. They're currently covered through Express Scripts. It'll stay the same come January.
Do we no longer use Ingenio after January 1st and switch to Express Scripts? Will we receive new cards? Discard the blue Medicare AA Advantage card.
Yeah, so this question's particular to our Medicare population. Can you stay Ingenio as the current, the incumbent prescription? Yeah, come January, change everything over to Express. Yes, new cards are coming out for both the Express Scripts cards and blue Medicare Advantage. So yeah, discard the Medicare Advantage plan you have after January 1st. Don't throw it out before that. After January, use the new one that's coming out to you and use the new Express Scripts card.
Just to piggyback that's why we think it's really important to make sure you're opening the mail from the fund office.
Right.
Any new cards would be mailed out.
Yeah, and that's not unique to Medicare. That's our Medicare population's getting new cards. Our active, our early retirees are all getting new cards. So like Joe said, open your mail, please. Make sure you have access to those.
Okay. Does the MD Health service Florida, especially for prescriptions?
Yeah, does MD Live work in Florida or really any state? Yes, they work in all 50 states, and especially for prescriptions, sure. So if you're a snowbird and you're lucky enough to spend winters down in Florida, that'll travel with you. If you're just traveling, let's say you take a trip to California, to South Carolina, whatever it is, that's really the benefit of having that app and making sure that's available to you. The one thing that will happen if you don't update, and we've had personal stories with it, if you don't update your state, the doctor, when they come on, is going to know you're out of state and ask you to transfer to a different guy.
Okay. Is there a maximum the plan will pay for a retiree over their lifespan?
No.
No.
So yeah, the question is there like a lifetime cap on how many benefits you could have? No.
Unlimited.
Okay, next question. If I'm looking to retire, what month is the best time to go out?
Yeah, so I'm going to guess this one's relating to those run out periods. And that's a good question. If you're looking to retire, is there a better month? Sure. Basically the start of a benefit period. So if you're looking to go out for April 1st or October 1st. That way you maximize those months where you're banking hours, so to speak. You're not having to pay us that premium to stay covered. So I would say if you have the luxury of picking, April 1st or October 1st.
How will I be notified on what level I qualify for?
2 ways, really. How would you be notified whether it's gold or silver come the start of each benefit period? Just like we do now, we'll send you a letter about a month before, letting you know what you're covered for. And I feel a little bit like a broken record saying, check your hours, log into my profile, and that'll tell you right on there. Did you qualify for gold? Did you qualify for silver? How many hours do you need to get up to gold if you're if you're looking at a silver plan right now.
Yeah, just to piggyback what Mike was saying, make sure you maximize that tool, that My Profile page. There's a lot of good information on there, and it is a good way to track your hours to find out whether or not you're going to qualify for eligibility and which level.
Next question. What happens to my current reciprocal forms?
Your current reciprocal forms will be automatically rolled over to the new fund. So if you already have a reciprocal on file with, say, Pittsburgh, you won't have to fill a new one out. Same thing with New York. Now, obviously, if we do not have one currently on file for, let's say, the state of North Carolina or the state of South Carolina, we would need a new reciprocal form for that point. But anything that's currently on file for, as far as reciprocal goes, will automatically be rolled over into the new fund. So you wouldn't have to fill one out for that.
Okay. Well, I need a new beneficiary form. Will it carry over?
Same answer as the reciprocal form. Yes, we're going to carry it over, just knowing that January is coming up as quick as it is. We want to make sure we have a beneficiary on file for you. But when we do release those new COBs come summertime, in all likelihood, it's going to include a new beneficiary form, just so we can be absolutely sure. Like I said, as important as that form is, we want to make sure we get that back from everybody, make sure our records are as up to date as possible.
Just to piggyback what Mike said, we can't stress how important it is to make sure you fill out or complete a beneficiary form, especially when you have a life-changing event. Unfortunately, if something happens to you, we want to make sure that those benefits get in the right hands.
Sorry, the question went away. It says, how will the merger impact retired members in New Jersey?
Yeah, so
You want to defer to me on that one, Mike?
Sure.
Oh, okay.
Yeah.
Immediately, it's not going to affect retired members, but one of the purposes of this merger is to bring together two really well-funded funds that have some really good resources. So when this health fund comes together, correct me if I'm wrong, Joe, but we're going to be somewhere about $700 million, hopefully, if investment income doesn't tank like it's been month in and month out. So with those types of resources and the amount of reserves that are available in the current Philadelphia plan as well as the current New Jersey plan, eventually we're going to look for ways to have parity. And right now, the Philadelphia participants have a very modest payment that they have to pay for either a single person or a couple. And in comparison, in New Jersey, it's up over about $1,000. So hopefully within a year or two, and we achieve the parity that we're looking for with the funding levels, we're going to look to try to bring down the cost of retirement for the New Jersey participants. Anything to add, Mike? Or?
So there's small health changes, namely, I think the important one was ambulance. Make sure to look, if you do have specific questions to your healthcare, go back to that slide or check out the YouTube channel.
Okay. Next question says, when will the COB forms be due?
So yeah, like I mentioned, typically we tell you make sure they're back no later, depending on the fund, by March 1st or April 1st. This year, we're going to move it out to summertime, and we'll see if that's something we want to continue. We know a lot of people, if you're covered under a spouse's plan, they typically renew in the summer anyway. July 1st is often the open enrollment. So for this coming year, it'll be sometime in the summer. Look for an email, look for a text, same way you probably found out about the webinar. We'll make sure that you know those dates, you know when they're coming out and when they're due back to us.
Okay, next question says, what if you have more than 600 hours in the 6-month period? Do we stop paying or do we get more coverage?
If you have more than 600 in the 6 months, so no, you don't get more coverage. There's not a 95 and 5 plan that you could qualify for, still the 90-10, but for a variety of reasons. So you don't want to stop at 600 hours. You figure your hours drive your HRA so you get more contributions. There is that 12-month look back, so you wouldn't want to say, let me stop at 600 and then hope I get another 6. Add those in. That way we're looking at that 12-month calculation. Going back to the pension and annuity, those hours drive those contributions as well. So there's no reason to want to say, okay, I hit my threshold. Let me cut it off. Keep working if you can.
Not to mention the paycheck.
Not to mention the paycheck. Yeah, most important. Sure.
Yeah, paycheck.
Yeah.
Okay. How do I know the balance in the HRA account or how much I've used during the benefit year?
2 ways. So going back to my profile, it'll be loaded there in the first couple weeks of January. So hopefully to make it quick and easy. But then we mentioned the important apps to have. Get the ProFlex app come January. That's also the easiest way to do it. Just log right in. There will be your balance. There is an annual statement if you wanted to see it. The HRA, it's not, I say it all the time, it's not like an FSA or an HSA where it expires. So knowing how much you need to use in a year, how much you have available isn't so important in an HRA. But if you did want to see that annual account statement, there is an option to do that on the app or the web portal.
You should get used to checking that anyway, just to make sure that all your,
It's accurate.
yeah, it's accurate and your contributions are coming in, and the transactions are accurate also. So.
Yep.
Okay, we have another HRA question. Are we able to get reimbursed for our out-of-pocket expenses through our HRA fund?
Yeah, that's what it's there for. So the question is, can you let me backtrack that slightly. It's there to cover what the IRS allows us to. So that's important. And that list, it's available on carpenters.fund. It's available on hsastore.com. We'll give you all the eligible. But yeah, if you have an out-of-pocket, it's important 1 year from the date of service. So don't hold on to those receipts and stockpile them. Get them in as you can and make sure we're giving you your money back.
Next question says, are nutritionists covered?
Yeah. If you look them up on Independence's website, they actually go by registered dietitians. But nutritionists, nutritional counseling, it's up to 6 times in a plan year.
Can you define a light commercial carpenter?
Yeah, light commercial in the Northeast, we're used to it. It's our shop and casino guys. In Philly, it's a specialized rate.
Yeah, I'll take that one,
I'll defer to Bill
Michael.
on that,
A light commercial carpenter is, there's a newly chartered local in the council. And although this question probably is not, in the category of what we're talking about now, those carpenters actually are part of local union 787, which is a council-wide local now. They used to be part of some of the commercial locals, and the light commercial carpenters are going to work on light commercial work as well as residential work and other specialty type work that's outside of the commercial collective bargaining agreements.
Okay. Next question says, what if I worked enough hours to qualify for the next benefit period, but the contractor hadn't paid the benefits to the fund office yet?
I'll take that one. I mean, that as far as the employer not paying the contributions for your hours, you should immediately track those on the My Profile page. And if there's a discrepancy, you should let our collections department know right away. And we will hound those employers to make sure they pay those benefits. Regardless, as long as you can prove it with your paycheck stubs, we will credit you those hours to make sure there's no lapse in your coverage.
As well as you should make sure that there's a shop steward on your job and that shop steward reports are being submitted on a weekly and or monthly basis.
Yep.
On a special medication through Accredo, does this change effective January 1st?
No. So this is for our non-Medicare group. You're an active guy or an early retiree. If you're getting a specialty through Accredo, it's going to be the same. And the nice thing, Accredo and Express Scripts are hand in hand. So if we're getting new ID cards, new ID numbers, that should flow over automatically. But like I said on the slide, if you have any issues with those drugs or any drug, not necessarily a specialty through Accredo, call us. We know there's going to be some hiccups, but we don't expect this one to be one of those.
Okay, we have another medication question. Unable to get drug price till account is active. Is the Express Scripts plan no deductible?
Yeah, I'm going to guess this is relating to our Medicare group. Yeah. So the short answer is no deductible. So like I said, no deductible on our in-network benefits through the active and early retiree, no deductibles on our Medicare plans either. We know with the shortened time frame we had to announce the Express Scripts change and the merger that was coming, there are some things they're still piecing together. Getting a copy of the drug prices and the formularies, it's tricky even if we weren't changing. Honestly, Medicare and the government dictate this each January. You have to put all your drugs through for their approval. So that's something that we're working on, hopefully to have for December 1st. But if you want to call the fund, let's say next week, see if we can get a price for you and know what drug you're talking about.
Okay, next question. It was mentioned retirees will need 30 credits to be eligible for medical insurance in retirement, and that you can only receive 1 credit per year. Does this mean carpenters with only 25 pension years will no longer be eligible for retiree medical coverage?
Yes, so going back to the earlier question, 30 is the new norm, but there are legacy benefits where you could be eligible at 25 years if you're Northeast and your hours are prior to 2011, or if you're a legacy Philly guy, there is an option to go out at 25. For specific questions relating to that, if you're coming up on retirement, call our pension department. They can walk you through whatever your particular case is.
Okay. When I retire with 30 good years, what happens to benefits if I move to another state, say South Carolina?
As long as you retire with our healthcare coverage, that's the advantage of our Blue Cross commercial plan, the non-Medicare. It travels state to state with you. There may be issues where you might have to find a new provider. We do find that sometimes, but the Blues are every state in the country. Same thing with our Blue Medicare plan. As long as the provider takes Medicare, they take the Blue Medicare. So that if you pick South Carolina, perfect spot, they'll travel there with you.
Okay, next question. Do we have to use CVS Pharmacy for the lowest prices on prescription medications? We've always used Rite Aid. Will we pay more there?
Yeah, is the short answer. Yes. So Express Scripts teamed up with CVS. They knew that they needed a retail partner to help with that. So the drugs are going to be cheaper, but primarily if you're on a generic, you figure you're paying your 5 or 10 no matter what. If you want to use Rite Aid for what's considered non-maintenance meds, so if you're filling an antibiotic, let's say for an infection, if you get Theraflu because you're sick in the wintertime, in that case, you're probably going to pay about the same thing. From the fund standpoint, it's a lower cost for the fund. So obviously we're going to encourage you to go to CVS. If you're on what's called a maintenance med, something you fill more than 3 times, in that case, that's going to be your only option. Non-Medicare, I'll specify that. Medicare, you can go anywhere you want. Non-Medicare, CVS or Express Scripts mail order only.
Yep.
Next question is, what is the benefit of the merger?
I guess that's mine again,
Yeah.
Michael.
Yeah.
Okay. Like we've stated, economies of scale. We're going to be bringing together 2 very large, they're not small or medium-sized health funds, but they're large health funds. And if anybody knows what we've been able to do with the level care program and things of that nature, we've been able to save money across the board for all the funds. By bringing these 2 funds together, we're not going to have 2 actuaries. We're not going to have 2 accountants, where there's several full-time, well, not full-time, but people that have to interact and work with our fund throughout the year. And we're going to be able to cut down on those services and save the fund money over time, as well as the economies of scale and our purchasing power. So it's definitely the right thing to do. A lot of you may know tradesmen that belong to some of the smaller unions, or perhaps maybe their funds are kind of consolidated in one small region rather than southeastern Pennsylvania and New Jersey. And if you look at what some of your friends in some of the other trades are paying hourly for their benefits, let me pick on sheet metal workers, electricians, etc. Their total packages exceed $100 an hour. And I know sometimes that's a point of contention, and everybody wants to know how come these guys make more than us and things of that nature. But the reality is, a lot of them, their benefits cost a lot more than your benefits do cost as well. And unfortunately, some of those rates and total packages are starting to price themselves out of a lot of the private sector markets. We need to be cognizant that we have prevailing wage work, we have large all union work, but we also have to fight for the small work that's out there in the private sector and the medium-sized jobs. And without those jobs, the world doesn't go around, and unions just get smaller and smaller, and they have to pay more for healthcare and other types of services. So we feel extremely strong that this move, as well as what we're doing with the pensions and the annuities, is the right thing to do for the strength, the future of this organization, and the future of the funds.
If I could just add to that, from the administrative side, when we go to a vendor, and this goes for anybody, if you show up with 5,000 lives, they're going to give you one price. Mm-hmm. If you show up with 8,000 lives, they're going to give you a lower price. When you come at them with a large group, and I think we're going to be over 20,000 what we call belly buttons. Yeah.
35,000.
Yeah.
Yeah.
When you add in certain groups, they really sharpen their pencils, and that's where you see a lot of the savings come into play. So as Bill mentioned, the economies of scale, when we can come with those numbers to a vendor, is where we can save a lot of money, and we can pass that money down to offering other types of benefits, which only get passed down to you. Yeah.
And the smaller unions get beat up by inflation in the medical world. I don't think there's a year that goes by where costs do not rise in medical.
Yeah.
Sometimes it's not too extreme, but we've had years in the past, and I think a lot of members that have been around as long as I have remember having to take collectively bargained increases and put a quarter or 35 cents into the health fund because the reserves have fallen so low in the fund. By doing what we're doing, we're setting the stage for the future where we're going to be able to hopefully offset the inflation that occurs with regards to medical services, treatments, prescription drugs, et cetera.
Okay, thank you. Next question says, will social media be the same?
Yeah, so we're going to go to one. So that's, again, just an administrative perk of the merger is we'll have one-stop shop for all your info. So it'll become carpenters.fund. The YouTube channel, the Instagram, the Facebook, it'll be the same Eastern Atlantic States, but we will have a new handle or a name for you to follow. If you hit our old ones, we'll make sure that come January it's updated just to either redirect you if possible or to give you the new address to make sure you're following the right benefits in the right page.
Mike, do you know, did we maintain the domain names or have we looked into that
For the website?
For the old
We're
two
gonna-
websites?
Yeah, the website
Okay.
would still going to be carpenters.fund. Yeah.
Yeah.
Okay.
So
Great.
if right now, if you're in the Northeast, you're ncf.fund.
Yep.
In that
.org.
case, you're
Yeah.
going to change over to carpenters.fund.
Got it.
But same thing, if you have it bookmarked to the old one, it's just going to move you right to the new one. That way you get your updated benefits, all that stuff.
And again, we'll communicate that to you through our communications tools that we have
Yeah.
when that change is made.
Well, that looks like all the questions we have for tonight. I apologize you can't see me anymore, but we appreciate you all joining tonight. Again, this will be uploaded to our YouTube channel for future viewing, and we hope you have a nice holiday.
Yeah.
Thank you.
Good night,
Have a
everyone.
nice Thanksgiving, folks. Thank you so much.